This is Shirley. She first came to my practice about 12 years ago. She was seeking long-term comprehensive dental care. She had orthodontics when she was in her 30s, and as a result of that, she lost most of the bone around all of her teeth. So she wanted me to develop a treatment plan for her that would last a lifetime. So my treatment plan was to extract all of her teeth and put 7 implants in her upper jaw and 5 implants in her lower jaw. And then we would make complete dentures that would be attached to those implants. It took Shirley 9 years to make that decision. So Shirley, if you could just kind of share with us kind of your thought process as to what led you to make that decision. I'm sure it was a very difficult, trying process for you, and most of our patients feel that way. You know, I hate to take, you know, folks' teeth out, but sometimes we have to do that. So can you kind of share?
Yeah, when I came to you, you come highly recommended as a dentist.
Mm-hmm.
But when you began to lay out the plan for me and help me to understand where I was going in terms of my bone loss, it was frightening, but at the same time, by then I had built up confidence in you. And I kept saying to you, just get me to a place where I'm on a plateau. Every time I think, okay, I finished the braces, if I take care of my teeth, I'll never have a problem again.
Mm-hmm.
But it wasn't that wasn't the case. So you just kind of walked me along, you know, each step of the way. And I remember saying to you, Doc, I'm not ready to do this. Just buy me some time. I need to get this in my brain and kind of get my brain around it.
Mm-hmm.
And I think what brought me to the point where I made the final decision,
Mm-hmm.
I knew in my mind I did not want dentures that you put in and out every day. My parents have gone through this. They're still struggling with whatever few remaining teeth they have. I didn't want that to be the pattern of my life at age 85, to turn around and say, oh, I had to have 2 more teeth pulled this
Sure.
week. But the last year, before I made this final decision and said to you, okay, go, was the year that I broke 2 teeth. You remember, just because my bite was so off, you had done everything you could to try to help me, but I just couldn't, I couldn't bite.
Mm-hmm.
And so by striking and breaking those teeth, I finally said to you, okay, it's got to be time, so let's go ahead and start this. And then came the anxiety. I mean, you know, I'm sure others feel, I got to go get all my teeth pulled.
Sure.
And I remember when you took close-ups and you showed me the close-ups, and I was just amazed at how awful my teeth really looked.
Mm-hmm.
And yet I said, they're still my teeth. It's like telling me, you know, take off my arm and I'll give you a new arm. It's still my arm.
Right.
I was very resistant, but I had made a decision. I had to do this, and I wanted the end product, and I was willing to go through that long, dark tunnel, I thought, to get there.
Sure.
So that brought me to the point where I decided, let's do it. And then from that point on, I mean, every step of the way, you've walked me through it. You've told me what to expect. I've had no surprises. You brought in a team like Dr. Zussman, you know, wonderful. You went with me. You were in the room when that was happening, when the teeth were extracted. It's been a wonderful experience. Not an experience that I would love to go through again,
Mm-hmm.
but every phase has been so great. And I look back now, and that was, what, August of '09?
Mm-hmm. Mm-hmm.
And so now, you know, it'll soon be 2 years we've been doing this, but you've brought me to a place where I can chew, I can have confidence in my smile, and
Mm-hmm.
and not worry about breaking teeth, and it's just been a great experience for me.
Can you just share with us, the big day is when we went to the surgeon's office and all your teeth were extracted, and on that same day we put in 12 implants, 7 on your upper jaw and 5 on your lower jaw. And a lot of patients are very apprehensive, very nervous about that day, about that procedure. So having all your teeth taken out, 12 implants in, just from a discomfort patient point of view, can you kind of just share with us?
Yeah, when the decision was made that all of my teeth would come out at once, you know, of course that's a traumatic thought process, but I knew that it was, you know, that was what we needed to do. And you gave me something to help my anxiety a little bit, something the night before, something that morning. I came in, you were there with me. The extractions really went very quickly and absolutely no pain, of course. And then my vanity kicked in, and I had said to you, do not make me leave one office and go to another office, you know, without any teeth, because you know, so the whole process of getting the teeth out, that was much more simple than I thought it would be, much more quick, much more painless. And then it was just a matter of, you know, you had the implants in, then you said to me, okay, now what we need for you to do, you and Dr. Zussman said, what we need for you to do is not chew. For how long? Well, ideally for 3 months. And I thought, how am I not going to chew for 3 months? But you know, you asked me for 12 weeks, I gave you 14. And I pureed my food, and I ate my vegetables pureed and whatever, and my mashed potatoes, and ate soups and whatever. It was a much less trying ordeal than I thought it would be. But I think that helped with the success, because you and Dr. Zussman both said, wow, wonderful, if we could just keep the pressure off of those implants while they, you know, adhere to the bone. And I guess it did, because it's been a great, I haven't had any problems.
Yeah,
so.
And you know, one of the big advantages of taking teeth out, putting implants in, and then putting teeth in the same day is that you're never without teeth.
Right.
A disadvantage is we don't want you to go out and eat steaks and hard things for a month. So, and you've been an ideal patient. You've done everything that we ask you to do, and this case has been very successful. And it's been a pleasure to, you know, work with you. Such a complying patient. Tell me about how you think these teeth look.
Well, I think they look great. You know how I'm picky, so I said to you, I want them just the right way. I want them just the right color. I want the gums just the right tint. You know, I want them to look natural. I've always had these eye teeth, prominent eye teeth, so I want that to be, you know, and you've just done everything I've asked you to do. And now people, most people who haven't seen me in years say, "You look beautiful. What have you done with yourself?"
Right,
you know, but those people at work, for example, who know what I've been going through, will say to me, "Have you got your final ones?" You know, they don't know from the transitional phase into the permanent phase that I'm there yet, because it's so natural for me. And so I'm very pleased. Every time you've done something for me, I've had a period of adjustment. I get used to it very quickly, but you know, hey, I know that I can pick up the phone and call you at any time and say, would this be right, or is this wrong, or whatever. I've not had to do that, but that's a lot. That's a lot of confidence to know that your doctors are there for you. They're available for you. They'll say, "Come in immediately. I can help you," or "Let me look at it," or "Tell me what you're experiencing," or whatever. So,
in the final result here, if you had it to do over, would you do it again?
I would. And you know, back when I got braces at age 30, I didn't even know what the word implant meant. So implants were not a viable option for me. But if you had started talking to me at age 40 or 50, I probably would not have been quick. I would have been just as resistant as I have been. because of the cost, because of what I had to go through and losing my real teeth and so forth. But how wonderful that now I look at my 85-year-old mother who's still struggling with losing a tooth here and there and having one pulled, and she's got bone loss. And I won't be doing that. If I'm here long enough to be 85 years old, I won't do that. I won't have that struggle. Maybe I will finally be on that plateau that I've asked you so long to give me.
Sure. Just to reiterate, dental implants have changed dentistry, and it's made patients like Shirley here, who were dealing with complex issues and never really had a good solution except complete dentures. Right. And now people can have all their teeth removed, and they're just like their natural teeth. They function like their natural teeth. They look like their natural teeth, and they'll keep their teeth for a lifetime. So Shirley, I just wanted to thank you.
Thanks.
For being such a good patient.
Thanks for being such a great doc. I appreciate it.
Okay, thanks.